The Canterbury earthquakes were New Zealand's worst natural disaster since the Napier earthquake of 1931. 185 people sadly lost their lives and about 5,800 were injured. People's lives were, and remain, disrupted. The cost of the Canterbury earthquakes is estimated to be about $40 billion. The public sector is responsible for about half of that. This cost was incurred by both local and central government to rebuild damaged infrastructure, community facilities, schools, hospitals and residential homes through the Earthquake Commission and Southern Response. The recovery involved private sector organisations, particularly insurance and construction companies, and many non-governmental organisations. Many public entities were affected and new ones were set up to respond to the earthquakes. Organisations had to work together to respond to the challenges and issues in the recovery. This complexity is typical of most recovery efforts from natural disasters.
I think one of the key things we learnt very early on was the sheer complexity of managing a recovery. Natural disaster affects people's lives in so many different ways, in terms of schools, hospitals and people's homes of course, people's mental health, their sense of well-being. So really the whole of government is required to respond to a natural disaster like the Canterbury earthquakes.
There had been a really cohesive response phase after the earthquake or earthquakes, but there had been less thought go into, well, who was doing what in regards to the recovery itself. We knew that the Earthquake Recovery Authority had been set up, but how were they going to be holding discussions with local authorities and other agencies that were on the ground?
I think one of the key things was clarity around roles and responsibilities, whose job it was to do the different tasks and getting the right governance structure in place. We also found that the engagement with the community is really, really important, both in terms of communicating with the community, but also finding ways and means to enable the community to have a role to play in the decision making.
As well as the challenges of coordinating and governing the response to the earthquakes, the public sector had to respond to unique and complex issues. Often, there was no blueprint for the public sector to draw on to respond to these issues.
So there's no rule book when it comes to recovering from a disaster, no rule book to say what should a local authority or even a central government agency be doing in the aftermath of an earthquake or a flood or any other kind of disaster like that. So everyone was really trying to undertake what they thought would be the best possible piece of work or role that they could see themselves undertaking.
In 2012, the then Auditor General, Lynn Provo, made a commitment that our office would provide assurance that the recovery was being carried out effectively, efficiently and appropriately. Alongside our annual audit work of public entities involved in the recovery, we carried out a program of work about the Canterbury recovery. This included reports on the roles, responsibilities and funding of public entities after the Canterbury earthquake, the Canterbury Home Repair Program, the arrangements to repair pipes and roads in Christchurch, the governance and accountability for 3 rebuild projects, and the Canterbury Earthquake Recovery Authority. We have provided advice to Parliament on the recovery effort and briefed select committees on the findings of these reports and our annual audits. We have also regularly met with people and organisations about the progress of the recovery. Through our work, we have reviewed many of the complexities of the recovery, including the challenges of managing uncertainty and working together to deliver rebuild projects.
Yeah, so I think one thing that we learned when we looked at CERA was the importance of being agile to adjust to the different phases of the recovery. So one of the recommendations that we made in the report is to continually look at your governance structure and see is it fit for the moment of the recovery now. Because at the early stages you needed a central directive framework, you needed that kind of directive leadership. Later on in the recovery, perhaps that type of leadership needed to adjust to allow for more local participation.
How do you start the process of rebuilding your city or rebuilding your communities back to a state where communities actually expect them to be rebuilt too. So achieving the level of service where people and communities want to live in. That's a massive challenge. You know, local authorities have constant conversations with their communities about the services that the local authority provides them. And doing that in a recovery setting provided a huge amount of challenge for a local authority. And it's not a task that one organisation can do in itself. It needs the support from central government, it needed the support from iwi through Ngāi Tahu, and it needed the support from other NGOs that were in Canterbury as well.
But with that, there's a tension there between, do you take a top-down approach, centrally driven, or how much do you work with local bodies and organisations to take a bottom-up approach? So managing the tension between a top-down and bottom-up approach is, I think, a key challenge in any recovery.
One thing that has been a challenge is having the right conversations right up front, because many people believed that the rebuild would be done and dusted in a very short time period, and that's just not going to be the case. It is impossible.
We know that recovery takes a long time. It can take up to 20 years, maybe even more. Certainly you can set milestones for rebuilding buildings, repairing infrastructure, but the effect on the well-being of a community is going to take a while. I think the important thing is that any work that is done to recover and rebuild a city has the long term in mind. We think about future generations in terms of the infrastructure, building back better, but also thinking about the long-term nature of recovery for people's sense of well-being.
Public entities must prepare for unlikely, yet potentially catastrophic events. We want public entities to use the lessons from Canterbury to help New Zealand prepare for the next disaster.
I think our final report on the Canterbury Earthquake Recovery Authority in particular sets out some key lessons and recommendations for the government thinking about any future recovery scenarios.
So I was at a conference over the last week, an engineering conference, and I heard a lot of really positive messages about lessons that had been learned from Canterbury and applied to the context in Kaikoura after the Kaikoura earthquakes late last year. And so I think that that's fantastic, because we're seeing some positive learnings being applied throughout the local authority sector. So we'll have to continue to monitor how public money is going to be spent in Canterbury. That's something that we have an active interest in. The long-term plans of the local authorities for 2018 to 28, so the 10-year period over that time horizon, is going to be a really good opportunity for local authorities to have conversations with their communities about the levels of service that those communities can expect to receive over the next 10 years, and have a voice with the council about where they want their communities to head in the future.